Hello and welcome to Agenda 2030. I am Desmond Utomen. On today's episode, we'll be talking about the coronavirus, otherwise known as COVID-19. We'll be speaking with a renowned medical practitioner, talking of Dr. Christopher Otabo. He will be shedding light on all that you need to know about the COVID-19. That will be when we come back from this break. Do stay with us. Welcome on program, Dr.
Thank
Otabo.
you for having me.
Okay, there's so much myth about COVID-19 globally and particularly in Nigeria. Some people believe that it's just one of those big scams. There is no virus, and even if there is, it's still part of the normal sicknesses that people have been suffering all along. What exactly is the true status of COVID-19?
Well, thank you very much for having me. COVID-19 is a real problem in the real world, and it exists, and it's killing people all over the world, and it's present with us in Nigeria. The virus was first noticed in Wuhan, in China, in the late 2019, and it came up like pneumonia, and it was killing people really fast. And so it got the attention of the medical system, and they began to study the pattern. And of course, they were able to isolate the virus, the pathogen, which is the virus. And it's called the coronavirus. Coronavirus is a group of virus. It's a spectrum. But this one specifically is what is called a novel coronavirus. Why it's called corona is that when you look at it under the microscope, you see stuff like crown on the surface of the virus. So there are many others that have come before. But the behavior of this virus vis-a-vis the symptomatology and the way it deals with the patient is different. So and that peculiarity is still a problem till today, and scientists are still studying it to find out more about it so that it can be linked. But as we speak, it's the world's greatest challenge until date, and a lot of work is going on. So to say that coronavirus does not exist is not true. To say that it's like many other things that we've seen in the past, like influenza and other things, is also not true. Maybe as the discussion goes on, we'll be able to pick out some of the peculiarities of the COVID-19.
What is the difference between the COVID-19? Since corona is not a new term, as it were. So why is this one different from every other member of that same family tagged corona and other sicknesses that are related to the kind of symptom that comes out with COVID-19?
Like the SARS means severe acute respiratory syndrome. So coronavirus is also a cause of it. And that one was more lethal than this COVID-19.
Kill faster?
Yes, it kills faster, and that has an advantage. Yeah, because the mortality rate for that one was somewhere in the neighborhood of 10%. So it kills almost like 10% of his victims. So it's infectious. And so one is able to contain it because, like Ebola, it quickly burns out itself. But COVID is different. The mortality rate is not as high. It's somewhere around 1%, 2%, in some cases up to 4%. Okay? So, and then secondly too, the incubation period is somewhere around 2 weeks, anytime from a few days to 2 weeks. But the problem is that people who have the virus have the ability to transmit the virus to others without being sick. That is the biggest problem the virus presents to the world. Because apparently normal people are going about shedding the virus because they don't have symptoms. So that makes it very tricky. So one person can give it to 100 people without knowing it. And then it just goes on in a cascade like that. So because of the high infectivity rate, so that 1% of people that it kills becomes significant. Imagine that within a month, 100,000 people are infected. 1% of that is 1,000 who could perish as a result of that infection. And of course, the 100,000 people will be sick, but would have the virus. About 80% would have minor symptoms. Many may not even have. And then the other 20% will be obviously sick. Maybe another 5% will require intensive care. Then a smaller number of that would die. So if we are looking at 100 million people and that will be potentially infected, that means we are looking at 1 million deaths. That's massive. So plus that, part of the problem is that there is no vaccine yet and no treatment for it. So at best, we do what we call symptomatic treatment. If someone has fever, you give antipyretics to reduce the fever. If he has cough, you give some soothing medications to reduce the cough. And if he has respiratory distress such that he can't breathe well, you may have to take over his respiration, and that's where the ventilators come in. So you just keep managing until the individual is able to muster enough defense to overcome the virus. But if not, unfortunately, many would succumb to it.
Yeah, you talk about some people do not have the symptoms, and that makes it even more challenging because you have quite a number of persons who are out there without symptoms and they do not know that they are carriers of this COVID-19. What do we do to those people because they are not being tested?
Yes, that's why contact tracing is very important. So if you know anyone who has come down with symptoms, we have to get to all those that have made contact with that person who is symptomatic. And that's where the word quarantine comes in, or isolation. You quarantine the people and make sure that they don't mix with others, whether they have symptoms or not. Because within 2 weeks, if they don't come down with symptoms, even if they had the virus, That means that their body, their immunity is strong enough to take care of the virus. And after 2 weeks, it's expected that the virus would have exited the system so they can go out. But within that 2 weeks, the fact that they have not had symptoms today does not mean that they will not have symptoms tomorrow. So if while under quarantine symptoms comes up, they would be treated appropriately and then also discharged. Before they are discharged, it's expected that they will test negative to the virus. And not just once, a number of times to be sure that the virus has actually cleared from the system. The body's immunity has a way of taking care of the virus and discarding it.
Is it safe to say that once you don't have symptoms within 14 days, it probably must have had contact with anybody knowingly or unknowingly, and you don't have symptoms within 14 days, it's safe to say that you are free of coronavirus?
Most likely, because that's what is known now. Within 40 days, whatever will manifest will manifest.
There is this report that says that a victim of coronavirus treated, tested negative, and came up with the COVID-19, became positive after some time. Is it possible that post-treatment, the virus can still come up?
Well, such cases have been reported in China where this first happened. What scientists are thinking of is that they may have been reinfected, which is a possibility. Because the fact that you had it before does not necessarily confer lifetime immunity. If you are exposed to the virus again, the virus can reinfect the same individual, and it will come down with symptoms. So it's not necessarily once and for all, like in many other diseases that confer immunity. So that is not established yet. So, but we are not aware that after one has tested negative a number of times, he will become positive without any reinfection. But studies are still going on.
If it is possible to get reinfected, what then is the role of the plasma that you spoke about that it generates after it gets tested negative?
Yes, the plasma is supposed to contain antibodies. See, because the virus is a protein, it has its own RNA. It gets into the body's immune system is stimulated to produce antibodies. So that antibodies is found in the blood. And you see, there are different types of tests for the coronavirus, COVID-19. There are some that you must have heard of test kits.
Yeah.
Those test kits, they test for the antibodies, not necessarily for the virus. But the one the federal government is using actually tests for the virus, and that's the polymerase chain reaction, PCR. So that's the one that you can be sure. You must have heard the Minister of Health saying he does not approve the test kits, because the test kit will test for the antibodies that the body has produced against the virus. Those antibodies remain in the plasma, and it's been postulated that if we get plasma from people who have been healed and infuse it into other people who are sick of the virus, it can help them to fight. The antibodies in that plasma can help fight against the disease. But it is new, and everything is still under experimentation.
Yeah, you've spoken about symptoms that cases could generate or develop before they know that they have COVID-19.
Yes.
Maybe you want to take us through what those symptoms are like. I know they talk about fever and coughing and sneezing, which has made it even difficult for people to sneeze around these days. Just take us through what those symptoms are.
You know, coronavirus, COVID-19, is a respiratory infection, which means that the virus has a predilection for the respiratory system. So it finds its way into the mouth or the nostrils, and then it's through the receptors, it attaches itself to the membrane, to the cells, and the lining in the airways, and it begins to multiply, and it goes down until it gets to the lungs. And the problem in the lungs is the attempt at the body to fight the virus. It stimulates an inflammatory reaction. That inflammatory reaction leads to swelling, leads to production of fluids. There are some chemicals, the cytokines, that are released. All that gamut of reactions, which is supposed to be good, but there's now an excess of it, and it causes the lungs to be compromised. So looking at this from the beginning when it enters the nostrils down, we can explain the symptoms. First of all, it starts with stuff like cough or upper respiratory tract infection signs, sneezing, dry cough, and maybe irritation in the airways, and of course that will lead to cough. And then after some time, you could the individual can come down with fever, because fever is a normal reaction of the body to infection because of the chemical reactions. Then with time, the person can come down with respiratory difficulties, and just a few of the patients will get to that. And if it gets to that, that's a mark of severity. So the patient will have difficulty in breathing. Gas exchange will be compromised because gas exchange takes place at the cellular level, at the alveoli in the lungs. And because of the swelling and clogging, there's no efficient gas exchange. And that leads to accumulation of carbon dioxide in the body, and that can compromise the patient. That's why many times for such patients who cannot breathe, you have to take over their breathing with the life support, which is called the ventilator. Yes.
Well, so much about this, the myth surrounding COVID-19 in Nigeria. There is this belief out there that our weather is so hot and COVID-19 cannot survive in our own, given the temperature that we have here. And probably that is the reason that we've not had a widespread of the virus and maybe much death recorded so far. How true is this?
Well, I cannot sit here to tell you it's true or not. There are a lot of postulations, but one thing is clear. The trajectory of the virus in Nigeria is mild and very, not as aggressive as it is in the West and even in China. I think from end of February, I think 27th, when the first case was reported, till date, we are still under
about 232.
232, less than 300. I remember that when it got to New York, there were 3 cases. Within 5 weeks, they crossed 50,000 cases. So people are thinking, what could be responsible for the slow progression of the virus in Africa? Some people say it's because Africans pray a lot. Well, that's on the lightest note. But looking at it from the scientific perspective, people have given different reasons. One of it is the weather condition, that perhaps the tropical climate could inhibit the spread of the virus. Others have said because we are under the heavy burden of malaria and we've taken a lot of anti-malarials, and some anti-malarials have been known to be active against the virus, maybe that has conferred some resistance to Africans. While others said it's not yet uhuru, that it's on its way. But whatever it is, we know that the behavior of the virus in this part of the world is different from what we saw or what we are seeing in New York, in Spain, in Italy, and in China. So it's a little bit more forgiving here than in those places. But exactly why, we don't know. Time will tell.
That means, should we be scared that the rainy season is coming?
Well, like I said, we don't know. But time would reveal what's going on.
Another myth out there is that perhaps the spread is also not much here because we don't have 5G here. That most of the countries where there is 5G already activated, the virus is spreading very fast. So what is the correlation, the relationship between COVID-19 and 5G technology?
Well, I don't know if there's any correlation. There has been a lot of postulations and there has been argument for and against. But what I know is that the virus has been recorded in some countries where there's no 5G at all. And in other countries where there's 5G, the virus has also been recorded. So I don't know if there's any correlation. I don't know, but there's nothing proven about that.
We still have with us Dr. Christopher Otabo. When we come back from this break, we'll continue to know how well the responses to the treatment of coronavirus, or COVID-19 as it's popularly called in Nigeria, is been going. Do stay with us. Welcome back. We still have with us Dr. Christopher Otabo with us in the studio, and we're talking about the COVID-19 and how it has changed almost the course of everything being done globally and also in Nigeria. Dr. Otabo, you've spoken about the complexity of this disease called COVID-19. How best do we start treating it in Nigeria?
Okay, thank you. To start with, there's no treatment. We manage it. When you say treatment for a particular disease, it means that you give a particular medication that has been proven to work for it, and when you give, you expect results. But as it were, there's no treatment for COVID-19, but you manage it.
Doesn't that look like a death sentence to anybody that has been affected or inflicted?
No, because the severity rate is not that high, and those who would develop symptoms are even few compared to all those that got infected. You've heard some high-ranking politicians come out to tell us that they have tested positive to the virus and yet they are still working from home, from their place of isolation. That tells you that not everybody will come down with the disease. But for the relatively few that will come down with it, you manage symptomatically. Like most viral illnesses, most viruses don't have cure. Most viral illness don't have cure. You just manage symptomatically and prepare the body in such a way that it will be able to adapt to the presence of the virus. And in a few cases, you can actually get rid of the virus. But vaccination is the sure way to prevent the virus getting into the body in the first place. But
that's not available now.
But work is still going on the vaccines. It's not yet done. So, but what can be done in Nigeria and what's done everywhere is to first of all identify the case from a high level of suspicion. Is when someone comes into the hospital, first of all, you want to find out the symptoms. It's not every cough that is COVID. It's not every fever that is COVID. And it's not every breathing difficulty that is COVID. You want to get the history and you want to get the symptomatology. Though the three symptoms combined gives you a very high index of suspicion. If one is coughing or sneezing and he has fever and is having breathing difficulties, is COVID until proven otherwise in this era? Okay? Then
you also want to find out the travel history. Has he been to any of the endemic countries where COVID is being fought right now? If that is yes, combining it with these symptoms, then you can make a tentative diagnosis of COVID and wait for a confirmation through the testing.
How threatening are people with asthma, asthmatic patients, and people with a history of with pneumonia?
Okay, now, people with asthma can have breathing difficulty, but the fever is not a common symptom. They can have cough. But the most important thing to differentiate asthma from COVID-19 is the history. The individual with asthma would know and will tell you that I am a known asthmatic. So you know. And then fever is not a common symptom of asthma, except if there's a super infection or there's a complicated asthma. So when the individual is identified, precautions are taken by the doctors with personal protective equipment to prevent themselves being infected. And also, the responsible thing to do is to prevent others from being infected. That's why they are isolated. And there are isolation centers around the country. And they are supposed to be taken to the isolation centers and monitored. Many of them, just monitoring and treating symptomatically would do. But for the ones that become more severe, other interventions will follow. But right now, like the US president announced some weeks ago, hydroxychloroquine with azithromycin has proven to be good in a number of cases. But the trial was a small trial in a small number of people. And it's not gone through the whole gamut of processes that would ensure that the FDA can approve it. So this is also for the purpose of the public, because I've received some patients who had what they thought was COVID, and they just went on to start taking chloroquine. And they actually came in here with chloroquine toxicity. Yes, fast heartbeat, drowsiness, and, fainting. Those are classic symptoms of chloroquine toxicity. Even if one is suspecting COVID, you are not to give yourself chloroquine. The fact that it's available in the market and the store does not mean that you go for it. It can cause more harm. People have died from chloroquine. Yes, let it be the call of the managing doctor to give you chloroquine. And when he does that, he will also prepare for the consequences. Okay.
If it is, nobody is sure of the treatment as it is now, it's just being managed. And in most cases, the symptoms are what is being managed. Yeah. Is it not possible for anybody to just visit any doctor for the treatment, for the management? You probably suspect that you have COVID-19, but you also know what symptoms you're experiencing. Can't you just walk up to any doctor and get some treatment to that respect?
No, it's not that easy. It's not safe, because that's like a dangerous person who is let loose. We're looking at the number of people that will be infected by that person. And also, you cannot predict the progression. You can't predict what will happen next. So it's better that you're in a place where the medical personnel have experience about the management of that case, and they will anticipate problems and prepare for it. So if you go to just any place and you suspect you have COVID, you just walk to any place and say, treat me, you are not doing the right thing. And the doctor that is also treating is not doing the right thing, because that's a disaster waiting to happen. Everybody in that facility will have it, because it's very, very contagious. And if you go home, by the time you are coming back, it could have metamorphosed into something else. So it's advisable to report and submit yourself to the center that is designated so that appropriate attention can be given.
Once treated of COVID-19, what is the guarantee that the virus will not remain in the body even when you test negative?
Studies are still going on, but when we test people after treatment, they are tested at least 3 times. When they become negative, they are allowed to go, and it's expected that the body has taken care of the virus. But we cannot rule out the possibility of a reinfection, because if someone is exposed again to the virus, it can equally reinfect the person, and that might be the cause for this new symptom that we're seeing.
Yeah, Nigeria is already looking forward to some respite with some doctors, experts coming in from China. Do you think this is in the right direction?
Well, I happen to have some information about this. I know because of what happened with China, the virus came out from China apparently, and so many controversies and conspiracies theory about China. So there's a general apprehension or suspicion, as it were, or paranoia concerning China. But I know for this one, the intention is to bring in consumables, personal protective equipment that are lacking in our hospitals, and bring them in the numbers. When Jack Ma brought some things for Africa, we all celebrated it. But what these guys are bringing are many times more than what Jack Ma brought. And because those things are written in Chinese, most of the equipment, people needed to come accompany the equipment. I've seen the list. Ventilators, respirators, so many wonderful things. And so people needed to come and explain the use and interpret and all that. And besides, these are guys who have gone through this path before, and they have experience. They can share experiences. They can share the lessons learned with us. So I think that the public perception is wrong, and that's because the information available is not sufficient. The impression is that the Minister of Health has gone to negotiate with Chinese doctors and is going to use taxpayers' money to bring them, and by so doing, spite the Nigerian professionals. Nigerian doctors are excellent. No one can take anything from them, and they have done very well in this fight. But the idea behind these Chinese doctors is to accompany the very much needed equipment that is being donated, by the Chinese company, who is part and parcel of this society here. What they are bringing is in hundreds of millions of naira to fight, the virus. So I believe that if Nigerians know, they would rather commend the company rather than castigate the government.
You spoke about isolation, quarantine, and all of that, which is one of the steps the government is taking to ensure that the spread is curtailed. Recently, the government decided to go their way of a lockdown in Lagos, Abuja, and I think Ogun State also. Some people have seen this as a very harsh decision taken on the people. How do you rate this?
Well, I think the lockdown is an international best practice based on recommendations from experts. The reason is because you want to reduce the social interaction, you want to reduce the contact between people, and in that case, you curtail the rate of spread of the virus. So the president made an announcement and specifically announced a lockdown for FCT, Abuja, Lagos, and Ogun State. I think that the president got it right with that. And I'm thinking too that that's probably why we are not seeing so much escalation. So if you allow people to continue as though nothing happened, they go to the parties, they go to work, they will infect their staff, they will infect the recreation centers, infect just almost anybody they come across. That will be a time bomb. because it's only a matter of time. The whole country would be in a mess. So this lockdown is helpful to flatten the curve. Yes, and the epidemic curve is such that it rises exponentially. And then after some time, the number of cases would go beyond what the hospitals can cater for. That's actually what leads to many of the deaths, even though the cases may not be very severe. But because the medical system is overwhelmed, people will die when they should not be dying. So this lockdown is one way of flattening the curve. Another way is good hand hygiene. We're advised to wash our hands with soap for at least 20 seconds because the soap tends to melt the wall of the virus. It creates holes in this virus and it kills it. So there must be some sustained contact, not just put your hand there and go out. Wash it for quite some time. Then we're advised not to shake hands with people, okay, because we can equally transmit the virus that way. We're advised to keep a safe distance, like what we are doing now, at least 1 meter apart or 3 feet. And then when we cough or sneeze, like we said, most sneezing and most coughing would not be COVID-19, but you never know. Yeah. So we're advised to sneeze into a flexed elbow or cough into a clean handkerchief or tissue paper, discard it and then wash the hands. Okay. Then the use of face masks is also important, especially for people who have symptoms. So when you use face masks, you protect other people. Yes. There has been this controversy about whether everybody should be using face masks. Well, that is not generally prescribed now, even though some countries are contemplating it because of the spread, the very fast spread, because people are beginning to think that it's airborne. But what we know up until now is that it spreads through droplets. You know, when we sneeze, we release a lot of droplets, aerosols, and it's inhaled, and then also it can stay on surfaces for some time, you know, and so on and so forth. But there's now a new school of thought that says that it can be in the air. And if it's in the air, then that will require that every one of us will use a face mask to prevent us from inhaling it. But that is also a subject of controversy. So all these things, if we do, it will help us to flatten the curve, which means that it will reduce the number of people who are sick of the virus per time. And that will give the health system the opportunity to recover. But if we have too many cases coming in at the same time, it will be disastrous for the population.
You talk about flattening the curve. Maybe you just want to give us more insight as to how this actually works, because maybe that is like you said, that is what is responsible for the government decision to effect the lockdown.
Okay.
So how does this actually work?
Okay, I can explain it using the graph.
Let's see.
Okay. Okay, so epidemics are usually represented in graphic form. By the way, a pandemic is a widespread epidemic that's in most parts of the world. So an epidemic is when you have a disease affecting so many people in a particular place at a particular time. So epidemics are usually represented in graphical formats. So we have the vertical axis, which represent the number of cases. And then we have the horizontal axis, which represent time. These two are very important in representing an epidemic because it's the number of cases per time that matter more than any other thing. So let's say this is 100 days. No, sorry. Let's say this is 100 cases on this. This is 1,000 cases. This is 10,000. And let's say this is 10,000. This is 100,000. And then this is 1 million. Okay. Then you have, this is the 0 point. So you have 30 days. You have 60 days, 90 days, 100 days, 120, 150 days, 180. Okay, so when the epidemic starts, it starts like this. As the time progresses, the number of cases rises. But this rise is exponential. It's not a direct rise, it's exponential. So the graph comes like this. So it rises up to a point. If nothing is done, it continues to rise until the disease burns itself out, or when it has killed as many people as possible, the maximum number of people, such that there are not too many people for it to infect anymore. And then it peaks and it begins to drop. Also, when there's a high herd immunity, when many people have developed immunity to the virus, that's when it also peaks. And then the cases begin to come down until it gets to 0. But this natural course of event is dangerous because so many people would be killed by the virus. Why? There's a line here which would represent the capacity of the healthcare system. Okay? So, in this case, the healthcare system can take 5,000 cases at any given time. Anything more than 5,000 means that the healthcare system is overwhelmed. So, numbers above this is calamity for the health system. Anything above 5,000, people will get to the hospital and they will not get treatment, even for minor cases that they would have survived. Why? Because the epidemic has overwhelmed the health system. You don't want this to happen. So we say we must flatten the curve. How do you flatten the curve? You want to reduce the rate of infection, and therefore you reduce the rate of rise of the graph. And how do you do that? You represent that by this. You flatten the curve. Okay? This, if something is done on time, the graph will not rise like this. It will be like this. And that is what the president tried to achieve and is achieving by having people stay at home. to flatten the curve and reduce the number of infection, such that you push the number of cases down to the level that it will be less than the hospital capacity. As things stand today in Nigeria, the number of cases of COVID-19 patients is far less than the hospital capacity. So we are fine. But if we allow people to move around and interact, the rate of infection would rapidly increase. Within a short time, you can overshoot 100,000 cases. But the moment you go above this 5,000, then mortality rates will increase because we have gone above the capacity of our healthcare system. So this is the epidemic curve. But another interesting thing about the epidemic curve is that when you flatten the curve, the number of infection reduces, but the time frame that the disease would stay will also be longer than in the epidemic, in the normal, natural epidemic curve. So this is what we mean by flattening the curve. So how do we flatten the curve? By reducing social interaction. That's what we are doing by staying at home. By washing our hands with soap after we sneeze. By using face mask when we are having upper respiratory tract symptoms like sneezing or coughing. And also, if you are close to anybody like that, you use face masks too. By maintaining a good social distance, at least 1.5 meters apart when you are talking, so you don't get droplets coming in. So by doing all these things, we reduce the rate of infection, we bend the curve, and we stay safe. Otherwise, the graph would go on its own natural course, like a free drive, and we'll be in trouble. Thank you.
Thank you very much, Dr. Otabor. But you would agree with me that to achieve this very beautiful curve that you have given to us here means that the government must have the buy-in of the people. Do you think we actually have that at the moment?
Well, there are challenges with keeping people at home. I must tell you, because of the demographics of our population, there are a lot of people who depend on daily wage for survival. And not too many people have the financial resources to sustain themselves for this period. It's quite challenging. And a lot of places of worship are also not happy because it's like their fundamental right is being taken away from them, albeit temporarily. The government is trying to respond to all the challenges that came up with the lockdown. The social security program has been scaled up, the conditional cash transfer and all that. But perception matters. A lot of people still think that the right targeting is not done. And so the government needs to do more in terms of responding to the problem that has arisen by reason of the lockdown. That's the only way people would stay at home. Reports that I got is that in the suburbs, people are not honoring the lockdown as much as in the city center. So a lot of education need to go on. The National Orientation Agency needs to do a lot more. The humanitarian ministry needs to do a lot more to bring succor to the real people who have concerns about survival while the lockdown is on. It also has economic ramifications. Yeah, I mean the world, the entire world is gone into a recession, and anytime soon a depression will be announced, except something dramatic happens. So that's the contemporary challenge that we have, as not just in Nigeria, it's all over the world.
Which is why we have to flatten the curve.
Yes, we need to flatten the curve.
Thank you very much, Dr. Otabor. It has been an awesome time with Dr. Christopher Otabo on Agenda 2030 for this week. He has spoken to us and enlightened us on what we need to know about COVID-19, precautionary measures we need to observe, and also what needs to be done when somebody around us is infected. And until we come your way next time on Agenda 2030, I am Desmond Utomen. We ask from this end that you stay safe, even as you keep observing all the guidelines.